position like they would be in the body, like if you're looking down on the, posterior abdominal wall. You can see the, the typical kidney shape with the ureters coming off. That's what these are. You never know how much of a ureter they'll give us when we get them from the slaughterhouse. This one we've already cut into, but we'll do this one for you now. And what you can also see is some remnants of that. That's actually parietal peritoneum in the back body wall, showing us that the kidney would actually be in, that retroperitoneal or behind the peritoneum space, covered over by the parietal peritoneum. So we can see that. We can see the hilum region here where the ureter comes out and where the blood vessels would come in. Sometimes when it looks like there might be a remnant of a renal artery and a renal vein there if I were to dissect it out. But what you see continuing all the way down here is the ureter, which also tends to be invested in quite a bit of fat. And we hopefully will be able to see inside the kidney where the urine enters into the ureter. So the idea is we're going to cut in a frontal plane so we get that view kind of like we saw in the images of the cortex and the medulla and the calyces inside the kidney. And so I'm just going to slice in this way and see what we get. In Miami especially, kidneys are pretty available at the butcher, so if you want to, cut your own one up, you can do that at home. And so as you can see, as I start to cut in here, let me see if we can get a little more light. You can see that outer cortex area, and the inner medulla is a much darker kind of color. And I'm just trying to cut straight back into those calyces, or the areas where the urine starts to collect, which is what you start to see there. And you can just see, compared to even the cadaver kidney, how much more vividly you can see the difference in the tissues in the fresh kidney. So this is the cortex region where we would have lots and lots of the glomeruli, where fluid filters out of the blood into the tubules of the kidney, where the kidney works, corrects that salt balance and also collects some of the nitrogenous waste that get eliminated. And then in these medullary pyramids, that's why they're called pyramids, because they kind of have that pyramid shape, is where you can almost see like striations of all of the collecting ducts lining up and heading into the region of the calyces. Between minor and major calyces, it's hard to say where the one ends and the other starts, but the smaller areas, these are just open connective tissue spaces where the urine collects and then continues to move towards what's called the renal pelvis. That's this region where all the calyces come together, and the urine then passes out into the ureter. We can see how close we got to maybe getting into the ureter from one of these caly spaces. I think I have to cut in a little bit further. And, it just depends whether we're exactly in the right plane. Maybe if we're lucky, if I'm going in through here, and you can see my ureter coming off on the other side of the kidney, and I don't know if you're going to appreciate that in the camera, but the probe is kind of going right. If I get it just right, now I'm into the inside of the ureter there with my probe as I continue on down. So there we go. And so that's how urine then would go through the ureter down to the bladder. So that's a nice look at, the inside of that kidney. If you want to see on the other one, it really looks just about the same. It's been a few days since it was cut open, so the contrast might not be as good, but again, just to show you the, little bit of variability. You've got the cortex around the outside, those nice medullary pyramids, the minor calyces coming into the major calyces, the renal pelvis, which then would be continuous into the ureter, where the urine would continue on down through the ureter to the bladder.